My name's Andy Rosenfarb, and I'm an acupuncturist, practice Chinese medicine in Westfield, New Jersey. This afternoon, we're going to be talking about healing the eyes with Chinese medicine. Chinese medicine includes acupuncture, Chinese herbs, massage techniques. Acupuncture is probably the most common thing that people have heard about. So, eye problems. Anybody here have eye problems? Show of hands. Anybody? Eye problems? Okay, we got a few. Anybody know anybody who has eye problems? Okay, so you got that. Everybody here have eyes? Yeah? Okay. So if you have eyes, this is pretty important information. You probably want to listen to this. This is how to take care of your eyes, things that you can do to keep your eyes healthy, and if your eyes start to go due to degenerative conditions or other kinds of conditions, these are some alternative things you can do. So, some common eye conditions that are treated: macular degeneration, wet or dry. There's Stargardt syndrome, which is juvenile macular degeneration, glaucoma, retinitis pigmentosa, Usher syndrome, optic neuritis, optic nerve atrophy, diabetic retinopathy, dry eyes, blurry vision, nearsighted, farsighted. That's probably most common. Migraine headaches. Some people don't know that's often caused by visual problems, one eye stronger than the other. Computer eye syndrome, from staring at the TV or the computer too long, can cause some eye problems. Anybody who works on a computer probably has had that, probably most of us. And floaters is another common condition that we see. Some causes of poor vision can be genetic. You can inherit bad eyes from your family or the genetic factors that can cause poor vision. Traumatic injury, illness, high fevers, things like herpes zoster or something like that around the eyes can cause some blindness. Certain drugs and medications can really damage your vision. Some cholesterol-lowering medications, some non-steroidal anti-inflammatories, allergy medications. These types of things can really have a negative impact on your eyes. Metabolic imbalances like diabetes can cause eye problems. Poor nutrition, eye strain, and of course stress, mental or emotional stress. Conventional medicine looks at the eyes and treats the eyes as just the eyes, or an isolated organ pathology. It means they look at the eyes, it's pretty much just the eyes, and this is what we're dealing with. Their basic approach is the decline of vision is said to be a natural process, and it'll usually get worse, and at best will stabilize, but you rarely hear that eye conditions will get better, especially chronic eye conditions, maybe acute conditions, but most chronic conditions are said to not improve. Conventional approaches for eye diseases are usually corrective contact lenses and glasses, certain medications to lower blood pressure, surgical procedures, and most common, they tell you to just wait and see what happens, which is pretty interesting. I hear a lot of patients with that. There's nothing to do. There's nothing to really offer. So they go home, try to develop your lifestyle and get used to starting to lose your vision. Chinese medicine looks at it in a different way. Instead of dealing with the eyes as just the eyes, we deal with the eyes with respect to the whole body. We look at the body as everything being connected, and the vision can be influenced by any and all the organs of the body. Primarily, the liver in Chinese medicine has a lot to do with the health of the eyes. When the liver's healthy, usually the eyes are healthy. When the liver has problems, gets sick, the eyes are going to have some problems, which is one of the reasons why a lot of medications that damage the liver can cause some eye problems. So really what we're talking about here is a holistic approach to vision therapy and keeping the eyes healthy. Chinese medicine includes, again, things like acupuncture, Chinese herbal medicine, moxibustion, which is a heat therapy, qigong eye exercises. Qigong is like a form of yoga, breathing techniques, which I'm going to get into. Nutritional supplementations, microcurrent stimulation, which is kind of a TENS unit that's been studied over the past 10 years and shows to have tremendous benefit on genetic or degenerative eye conditions. Also Chinese aromatherapy, which is use of essential oils around the eyes and on specific acupuncture points, is shown to have a very, very good benefit in preserving the eyes and in addition to helping them improve, to see better. Now, what's acupuncture? Acupuncture is the insertion of fine needles into specific points or areas around the body. For the eyes specifically, we're going to put acupuncture needles, these are acupuncture needles, which you see up there, are inserted into specific points to send signals to the brain to increase circulation to the retina and to stimulate the optic nerve specifically, and cerebral function to help the eyes to see better. It directly has a direct stimulation. So you put the point in, sends immediate signal through the spinal cord to the brain, to the visual cortex area to get the vision going better. Microacupuncture is a system of acupuncture that's a little more recently developed. Traditional acupuncture is about 3,000 to 5,000 years old. Microacupuncture is a relatively new acupuncture procedure which consists of 48 acupuncture needles, or 48 acupuncture points, rather, in the hands and feet. These points have been studied to be specifically beneficial for patients with eye conditions. Originally, they looked at this to help with arthritis, did okay with arthritis, but patients who were being treated reported to see very good benefits in terms of vision improvement. So in clinical studies, we've seen about 80% of patients with these types of degenerative eye conditions have shown some type of improvement. Recent research on acupuncture for eye disorders on an array of different eye conditions, including macular degeneration, diabetic retinopathy, retinitis pigmentosa, glaucoma, optic nerve atrophy, so on and so forth. There's a lot more research being published. Most of the research is overseas, Europe and China and Korea, but we're getting more and more studies in the United States, which we're trying to work on currently as well. Chinese herbal medicine. Chinese herbs have been used also for thousands of years to treat various health conditions. Herbs can be used individually, the specific herbs, like people have heard of ginseng or even green tea. Astragalus is another common herb. Lychee berries, these are more common herbs. Or they can be used together in Chinese herbal formulas. These formulas can be prepared as teas or soups. You put all the herbs in a pot, boil them up in a soup and take them. They can be used as tinctures, alcohol extracts, granules, powders, tablets, capsules, so on and so forth. Even topical plasters, which is when we talk about using the Chinese herbs for aromatherapy, it's really the same thing. We're taking the herbs, putting it in an oil-based extract, putting it topically on the skin so the body can absorb it and help with whatever condition we're trying to improve. Some common Chinese herbs, again, are lychee berries. Chrysanthemum is very powerful herb to help with the eyes. Prunella, bupleurum, rhamania, these all really help nourish the eyes. What they do also in Western medicine and in nutrition, they balance out the blood sugar. Blood sugar is very, very common, a common occurrence with vision problems. Diabetics know that because there's that high risk of high blood sugar causing eye problems. In addition, a lot of patients with low blood sugar, hypoglycemia problems, have conditions of myopia and macular degeneration, retinitis pigmentosa. So a lot of these herbs and nutrients are used to stabilize the blood sugar, and that in turn will help improve the state of the vision.